Good afternoon, everyone, and thank you for joining us for this special virtual event, COVID-19 Peer Sharing for California Provider Organizations, which was repurposed from the CalHive launch webinar. We're really delighted that you're here to join us today. Today's webinar will feature our CQC team. As a reminder, the session is just being recorded and will be available to you after the webinar is complete. We'll be sending the presentation slides, the recordings, as well as any URLs and resources mentioned via email to registrants. Before we get started, I would like to review a few Zoom tips. All attendees are muted upon entry to ensure no background noise is coming through. If you're joining us through a phone, please refrain from using the hold button to eliminate any background music as well. Again, your lines will be muted. If you're having any technical difficulties with your audio and/or your video, please direct your messages to me, Michelle, and I'll do my best to assist you as any issues arise. We'd appreciate it if everyone could also enable their video so we could see who's in attendance as well. If you have any questions or comments, please utilize the chat box and we'll moderate and answer as best we can. Throughout the webinar, we'll be asking a couple of polling questions and a quick update on how to correctly answer and make sure your answer is submitted. Please select from the multiple choice options when the poll window pops up. Then click the blue submit button to complete the poll. When your answer is submitted, then the pop-up window will disappear. If you simply just click the button, click the answer, your answer is not submitted. So make sure you click that submit blue button. For those unfamiliar with CQC, we are California Quality Collaborative, a healthcare improvement organization that generates scalable and measurable improvement in the care delivery system. We're governed by a multi-stakeholder committee administered by the Pacific Business Group on Health. At this time, can we please have all participants add their names and organizations to the chat box? Thanks, everybody. It's great to see all of you here. Okay, as everybody continues to submit their names and their organizations, we're going to do our first poll. From where are you dialing in? If you can make your selections and let us know, that'd be great. We'll go for a couple more seconds to give everybody a chance to submit their answers. Welcome, everybody from SoCal. Okay, we're going to end the polling. Great to see you all. And now, at this time, I'm going to turn it over to Crystal Eubanks.
Hi, good morning, everyone. I'm Crystal Eubanks. I'm the Director of Care Redesign Strategy and Programs. And I just say thank you for coming today. I know that everyone is under personal and professional stress and working as hard as we can to support everyone. So thank you for taking the time to join us. And I'm so glad to see a lot of familiar friends and a lot of newcomers. And so we're very glad to have you and participate in this discussion. So we originally were going to launch our new program this year, and Monday morning realized we're going to postpone that and instead ask ourselves, how can we help? So in the current situation. So A brief announcement that the CalHive Network, which was our kind of next era of practice transformation work in California, that was scheduled to launch in around July, is going to be postponed for later in 2020. We'll give some dates and details as we know them and plan them. But I know some of you were going to show up to hear about CalHive. If you're interested in hearing more, just let us know in a chat box message or email us, and we're happy to follow up one-on-one and share what's going on and give you the details there. So yeah, move on. So I just want to say, so as a Monday morning, we said, okay, let's not launch CalHive, but how can we help? What can CQC do? You guys are on the front lines, and we support you, and we ourselves came from the front lines at some point, and so we really said, how about the California Quality Collaborative as a convener? We bring people together for peer learning and sharing, right? That's what we believe in. And so we said, how can we use this time to reach out to those, I think particularly in the ambulatory care world, to see if there's an opportunity to share amongst each other around our preparation, what we're doing now. So today, we really want to source from you guys, provider resources that you're using and finding helpful. Where might there be other forums for exchanging ideas? Maybe it's regional, statewide. So we'll do some information resource sharing, and then we'll have some discussion around our challenges and solutions. So let's surface our biggest challenges and see if we have some solutions from the group to share that we could leverage. And then lastly, kind of digging into what external support do you guys need that we can help marshal, right? And so while we have many provider organizations on the phone, we also have health plans, funders, other technical assistance organizations who are wanting to hear from you guys. What do you need so we can help support you in that? So today's webinar is not so much a webinar as really a dialogue. So feel free to put in the chat box a message that you're thinking. Also, when we have some discussion points, unmute yourselves, right? So #6 if you're on the phone, #6, whatever. If you're on your computer, right, you can do the drop down and hit unmute. So we encourage you to really jump in and don't be shy. We really want to hear from you. Yeah, so let's move on. So I thought maybe to get us going and before we just jump into challenges is to remind ourselves of some of the silver lining that's out there. And so I keep thinking I'm so inspired by what I see happening through online and even in my own neighborhood. So we'd love to hear from you. Give us this dose of positivity to start during this difficult time. What have you seen that has inspired you professionally or personally in the past few days? And feel free to put it in the chat. And we'll see what comes of it. So I see Lindsay sharing that the flexibility and collaboration of coworkers and everyone. Yes, that has been amazing. And let's see, and David shares the efforts to help the state and counties understand hospital capacity. Yeah, so it's getting us to do this bit of kind of coordination and connecting that we've always wanted to do and now have to do. Yes, and voluntary self-quarantine, exactly. So some of you are joining us from work, some of you are joining us from homes or wherever you are. So we hope that you are safe and well and pulling together and supporting everyone and particularly those in need. So thank you for those silver linings. I'm loving it. Yes, and I see Stephen's local distillery repurposing equipment to make hand sanitizer. This is awesome. Getting us to be creative in ways that we haven't yet or think outside the box. So thank you all for that. And so let's jump into the topic at hand. Let's start sharing some information resources. Michael Al is going to kick us off.
Thank you, Crystal, and thank you for it. I love all the responses that I saw. And hello everyone. Michael Al, project manager for CQC, and to start us off with the sharing and learning, we'll jump right into this first question that we see here. What information resources with COVID-19 are you relying on and finding most helpful? As was mentioned earlier, statewide resources are great. Would also love to hear about local or regional resources. We can take a moment, please utilize the chat and link to the best thing that you found shared. But I would also, invite people to unmute yourself and maybe speak a bit more about the resource you're recommending and how or why it's helped you.
Hi, can you hear me? This is Libby Hoy with PFCC Partners. Just to start the ball rolling, I think what I'm finding helpful is our local health department, Long Beach Health Department, putting out regular updates almost daily, or I think daily. And that's been really helpful. I'm finding the CDC output helpful as well, but a little bit more difficult to get my hands around to share with our broad patient community. So trying to sort of modify those, not modify the message, but share it in a way that's really useful to the community. So I think we feel a large sense of responsibility to ensure that we're spreading credible information. And so I really look for more of those sources in a way that we can spread to the patients or people.
Thank you for that share, Libby.
Michael, this is April Watson with TQC. So hi, everybody. I'm seeing a couple things come through the chat, so maybe I'll just read those off if that's okay. Fiona, I think that's Fiona Wilson. Hi, Fiona. Is chatting in the JAMA Open Network, so rapid access to medical studies, experience from on the ground in China and Italy, kind of the hot off the press evidence and experience that they're, I think, a lot of these journals are kind of bringing down their paywalls for a lot of this content related to COVID-19. So I think that's one example. And then someone, B. Hodgkin, said, we've used the CDC Riverside County Department of Public Health to adopt and develop content for our community. So thanks to both of you. That's great. Please keep them coming.
As you think of those resources and those links, feel free to send those into the chat box throughout the webinar today. We'll be compiling that list and sending it out with the slides and the recording. So no worries if you can't get to it now.
Oh, this is great. So someone's chatting in excellent communication with LabCorp on accessing testing kits and processing results. If whoever's chatting that in wouldn't mind unmuting and saying a little bit more about that, talking through the communication, what is that looking like? How is that happening? Would just love to dig a little bit more into that comment. That would be great.
Also,
and I think Michelle, oh yeah, go ahead.
I just want to call out this question from Aaron Brinko in case someone's not looking at the chat. If anyone has any advice or resources for uninsured who may have symptoms.
This is Stephen. I may have a resource to check out, but I'm digging right now.
So this is Dave Cates. I don't know, I'm not the person that wrote the LabCorp comment, but we have actually had good communication with Quest. We've not heard back from LabCorp yet. And they have identified how orders and results are going to be electronically communicated to their reference lab. And it's pretty consistent with how other lab tests are ordered from facilities. And they've established a test code and result codes and all the details. So they've been pretty helpful in terms of identifying that. And we've had some conversations with the governor's office in the state that the state is also getting results through electronic laboratory reporting for those types of tests. But given the nature of those reference labs, there's not really good contact information. So we're hoping to be able to help them triangulate that and give more phone number, email, other contact information for patients that are identified as positive.
Hi, this is Kurt from IHP. Can you hear me now?
Yes.
Okay.
Yes, we can hear you. Thanks.
Okay, before I was muted. Not
sorry.
me, but
Okay.
on your end.
Yeah.
Okay, so similar to that gentleman said, LabCorp, we have contracts actually both with LabCorp and Quest, and we found LabCorp to be much more responsive, communicating how many test kits they had. They offered up to 50 test kits per physician to our network. We connected our Riverside County hospital with LabCorp and had a 3-way phone conference, and they were able to get an agreement with LabCorp in 1 day to be able to get the test kits and do the processing. And they were just overall LabCorp was very responsive. Quest, I think a lot of it depends on your account manager. Sort of had to pull the information from them, but majority of our business goes through LabCorp. So, but the county was very pleased in working with LabCorp, and it went well moving forward, and they got the test kits very quickly.
Great, thank you. And I wanted to point out, Aaron, you'd asked a question about the uninsured, and Lindsay responded with the uninsured can access care through the local FQHCs, and so wherever they are to send them in that direction. I think that hasn't changed between normal operations and the current situation.
And how would someone know where the FQHCs are in a particular area?
Great question. And by FQHC, they're talking about federally qualified health centers, the community health centers. They're typically come up in any mapping situation, but the California Primary Care Association has a full list of those in California and by region. So CPCA, the California Primary Care Association. Yeah, so you can direct that messaging. And I'm seeing some notes from Fiona about UCSF Health website, and I saw Amy put in a link to some sources on LinkedIn. And I'm super excited to see that Riverside County is already jumping into offering drive-up screening stations. So that's incredible, and I know that many across the country are struggling to get that going. So that's awesome to see.
This is Stephen. In thinking about the resources that were super helpful for patients and families, I think it was Blue Cross Blue Shield recently sent out updates to their membership or their group that highlighted the fees and ways in which patients should seek care if presenting with flu-like symptoms, including the direct link for the telehealth efforts and such. So that information for patients and families is very helpful resources coming from the payers.
Thank you, Stephen. Just want to call out a few more comments I'm seeing here. I'm seeing from Maniti, Plaintree had an excellent webinar entitled Let's Talk About Person-Centered Care During Pandemics, and it looks like that will be available on their website tomorrow. And a couple more comments. Mary Renner, thank you for pointing out HRSA as a health center locator tool. Thank you for that. And from Christina, the California Primary Care Association list of member FQHCs. Thank you for that link. And just another reminder, thank you again, everyone, for these resources. And at the end of this session, we'll compile these and get them out to all of the participants. And at this time, I think I want to move us on to the next discussion item. Okay, so for this next dedicated amount of time, we'd like to surface challenges and exchange solutions you may have implemented at your organization already. To help us to open up and help guide this discussion, in a moment, we'll have another poll to help us identify the top challenges we are currently facing. So if that could come up. Thank you, Michelle. So please take some time now to view and select a choice, and we will display those results momentarily. And just a reminder, if you select other, please go ahead and submit and add your response to the chat box.
Yeah, and I'll just say as people are responding, this is April Watson again. You know, we as a team just sat down and tried to take guesses, somewhat in the dark about what your challenges might be. So please, you know, you are much closer to the front lines of care. Let us know in the chat box, like choose other, and let us know what the challenges are, because we are certain we probably didn't get this list quite right. So please tell us.
Okay, thank you everyone for your submissions. So we should be seeing the poll results at this time. So just to call out what's at the top, very obviously we have access to testing as the biggest challenge that a lot of you are currently facing. Looks like a good even spread between a lot of the other challenges that we had initially identified. Access to protective gear, telehealth, patient communication. And just to call out one of the others that I see in the chat box from Manidi, thank you. How to ensure we mitigate isolation of individuals while we support the social and emotional needs of the communities we serve. Thank you for that. And I'll call out this one as well from Hodgkins, developing plans to move non-clinical staff to work from home. Starting to feel PPE supply crunch. Testing kits were difficult to get early. Yes, thank you for calling that out. So I guess at this moment, you know, now that we've sort of identified challenges and you know, this big one that we have here is access to testing, but you know, how is your organization supporting providers with these challenges? Or maybe where is your organization struggling in support? Sorry. So again, please feel free to unmute yourself and just jump right in. We'd love to hear your voice.
So this is Crystal. I just want to ask first, maybe focus is where, in addition to what you shared earlier in the kind of conversations and with both LabCorp and Quest is, are there other ways in which you had success in supporting and getting your providers and practices and contracted, your network, broader network access to testing? So maybe we can like surface some successes and build on that. And then we can get into how we might still be struggling. And
Crystal, this is Deanne McKellen. Can you hear me from Calahipso?
we can. Good morning, Deanne.
So slightly off, more on the protective gear and whatnot. I've seen some exchanges in the past 24 hours of at a very local level, and like some of your health centers or your practices or public, like county services might not be aware, to ask locally of construction workers and that industry, or even dental, to in a sense share protective gear that they might have inventory of, but they're not using for being an emergent only guidance, or actually even shut down from working, that they might have some gear that could be utilized in the short term while supplies kind of balance and get shifted. Because I've also heard that a lot of the suppliers have had computer models that are based upon prior use. So a primary care practice prior use over 6 or 12 months time might show a much lower number than a dental office down the street. So they're tweaking those models, but why not encourage them to talk as a community to kind of pass some of the equipment supplies around if they have them.
Great, thank you, Deanne. And for those out there, are you fielding offers from any of these kind of businesses and organizations? Because we've heard of similar offers from some other organizations up here around the Bay Area. But I'm thinking about the burden on you to go out and try to get those right now. Are you fielding offers, and maybe there's an opportunity to for someone else to do that for you so you could be providing care?
If I might take a moment as well, just to read off a comment I'm seeing here from, fortunately just says user, but if you'd like to unmute yourself and talk a little bit more about your comment. A thought for possible future allocation of hospital resources. I think it would be useful, but have not seen a possible future plan for triaging other medical admissions to conserve limited resources.
This is Jose from CQC. Actually, I want to share a challenge that has been experienced a little bit here in the area. It's in, I believe, in marine community clinics. I was talking to a member yesterday, and actually they were experiencing from some patients fear of actually coming to pick up their prescriptions sometimes because of the shelter thing that's going on here in 6 counties in the Bay Area. And some of those patients not just with fear of being stopped by the police, but also facing of that being linked to deportation sometimes. So just thinking about how can we help those people with the right information that is being outside there. Yeah, something to think about.
Yeah, this is Stephen, and I was going to make the offer to anyone on the call. Our organization's commitment is or way to support is to help health systems develop effective patient communication. And if any of you would like to review your patient communication or patient engagement efforts with patients and families, our network is on standby and ready to support those efforts if for those of you struggling with that piece.
Thanks, Stephen. Remind us of your organization and how could we get in touch with you most effectively.
I'm sorry.
No worries.
PFCC Partners, and I will put my email in the chat box now.
Beautiful. Thank you for that offer. I'm also wondering, circling back to one of the earlier topics about Riverside starting the drive-through testing, the person that shared that, if you wouldn't mind giving us a few more details and some insight to either how it's being operationalized, because I assume it's just getting off the ground, or if you've, what kind of early results you've seen.
This is April. I'd like to ask a question. So I've seen a little bit and been in touch with some folks who are part of kind of larger integrated systems, and have seen kind of how they're pushing out information to practices and providers. I'm really curious about, and I think I saw some participants here who are with IPAs. I'm really curious about kind of those solo or very small practices, and whether and how they're getting support. Anyone on this call who might be part of an IPA type organization or works with small practices, just curious, or is that a real gap, which is, a possibility, but just curious to know what you're hearing and doing, and would love to surface that. Michelle, would you mind reminding folks? Oh yeah, sorry, go ahead, Erin. I was going to ask Michelle to remind people how to unmute in case that's a challenge.
I don't have anything really earth-shattering to share. We have been, we've updated our websites like most, posting information on COVID-19 to our patient population. We have expanded, telehealth. Actually, that was something we were doing regardless of COVID-19. And we have daily emails going out to our physicians. I'm actually working on getting my hands on that, since I don't work with the practices directly as much anymore. But we are trying to be as transparent and push out as much communication as we can. Michelle, I noticed you were on the call. Do you know anything else that Hill's doing?
So Michelle Ma, can you unmute yourself and just remind people how to unmute themselves? I think that might be a challenge. I'm noticing a couple people putting that in the chat, and then maybe also write it in chat.
Yes, just a reminder to everybody, you hover over your picture if you have, or your name on the screen, a blue pop-up comes up that says unmute. Also, if you have the participant window, and participants, you pop that open, you see a microphone and you can unmute. Or you can always send me a chat message and I'm happy to unmute for you. So just let me know.
So while we deal with some technical challenges, I just did want to highlight a comment, and hi everybody, this is Peter Robertson from the CQC team. A comment that had come in from Claudia Williams with Manifest MedX, and they're actively working to support HIEs across the state to monitor hospital ED use occupancy and ICU occupancy as this pandemic progresses, and they're sharing daily reports with the state and are willing to share those locally with others as necessary. So please feel free to reach out to Claudia if you can make use of those resources. And Claudia, it'd be great if you could share a method of the folks to contact you in the chat, if that's possible.
And while you do that, I'm wondering about, right, so I hear this repeated, like have the health, the health providers reach out and draw it down. Is there any kind of push system so that they don't have to pull from all the different resources? And so is there value in, I don't know if that's something Manifest does, or can we do it, or someone else? Is there value in having someone else do that on you guys' behalf so that you're not having to pull it down all the time?
This is Dave. Excuse me, Dave Cates from Manifest, also while Claudia's having technical issues. So we are looking at working with like some of the public health agencies, and could work with others if there is, if you will, a panel of patients that are patients under investigation, or that you want to surveil related to the outbreak. We do have some push mechanisms to be able to keep organizations apprised of that. So when Claudia left her email address, let's have her be the primary point of contact, but that's also something we'd be happy to talk about with interested folks.
Hey, can you guys hear me?
Yeah.
Yes. Yeah.
Okay. Sorry, it took I'm like, is it my phone? Is it the computer? Just to clarify, we are in process with those reports, so we're not yet sharing them with the state. But we are essentially using our ADT feeds, the admit discharge transfer feeds. So there are about 200 plus hospitals across the state that are currently sharing data with an HIE or another kind of related organization. So the conversation we're having with the state is, could we actually create aggregated reports? We'll send our reports for the 80 hospitals we're connected to, but could we send aggregated reports that would allow them to see what the trends are by hospital, both for ICU occupancy as well as overall occupancy, and for ED as well. One thing that's interesting is, obviously we should be a source of, one thing we're hearing from plans and providers is they don't necessarily hear back from the public health or hospital testing. So they may have capacity to reach out to people who aren't in the hospital to say, we know you're positive, if you have any questions, but they're not finding out. Like we heard from one health plan that the way they know is when people initiate from the hospital. So we talked with folks in the state yesterday about potentially relaying positive cases to us, and we could then get them out to providers and plans. We know the attribution. They were very opposed. They said, listen, we just don't feel comfortable with that. But I think I think we should be, one opportunity for advocacy is saying to the state, you need to use intermediaries, whether those are IPAs or health plans or MX, to transmit information about positive folks, because there are people in the system that could help those patients before they show up at the hospital. And I don't know if others have had the same experience. I'm sure they're nervous about sharing that information, but it basically means a positive patient could end up showing up at the ED and they don't know that patient's positive. And so I just think I'd be super curious to hear other people, and maybe locally you've gotten, we'll be getting the results from LabCorp and Quest, and we have results from a couple of the local public health labs, but we don't have all of them. So we are not going to be able to serve that function unless we can find someone to get the data from. So curious if others have had the same challenge. Right now, given that so many people are not being tested, it's not as much of an issue because there are a lot of positive folks that are just not, we don't have results for, but I assume that will shift over time. So I would love any thoughts, and responses. I know the CMA put out a letter, but I don't think it addressed this issue particularly. And Claudia, just before people respond, do you mind, just in case there's folks on the phone who don't know your organization, just briefly saying who you're with and what your organization is? That'd be great. Sure. So we bring together claims and clinical data for about 20 million folks in the state. We work with Anthem, Blue Shield, HealthNet, IHP. We don't have claims for all of our plans yet. And then we work with about 100 hospitals, and we have the admit, discharge, transfer data from those hospitals. So for instance, for Hill, and then, so another use case that we've been really excited about is for those patients for whom we have claims data, we could actually go in and do a screen of over 65 diabetes, asthma, cardiovascular disease, and send that list to an IPA or a health plan. So we've talked to a couple plans who are interested. We could do that right now for Anthem and Blue Shield members, for instance. One of the things we don't know is who in the system has capacity to reach out. So we don't want to inundate a bunch of docs with that information if they're just like overwhelmed. But plans and IPAs certainly are a great node in the network to play that role. So we're happy to talk with anybody offline who's interested in for their Blue Shield, and we would need to load a panel if you're not already a participant of your patients, but then we could match that against our claims. Yeah, happy to talk offline with anyone, or even if we wanted, I'm happy to share more info. Thank you so much.
Yeah, thanks. And I think I want to emphasize that point you made about the health plans and the IPAs being great intermediaries to do the outreach, right? And to shift that away from practices, which that's generally a good practice when it comes to the tiny ones, right? 1 or 2 docs. So if there anyone from an IPA or a health plan that's willing to speak about your outreach.
This is Michelle Duran. Can you hear me?
Yes.
Okay. We have been calling all of our practices to find out what they're doing, and it's different across the board. Some are closing their offices. Some are doing the testing in their office if they have kits. The problem is a lot of them don't have the PPE, but they're still providing the testing. Yeah, it's across the board. But the struggle is getting the kits and the testing kits and the PPE. I think those are the two most, the things they're struggling with most.
So getting that out to small practices. And is there a role that you guys play as an IPA or a request?
Well, like Erin said, we're sending out information. We're trying to go through the public health to order PPE. We don't know how long that's going to take to get for our practices. They are referring patients to the ER, and the hospitals are screening them at the entrance. And if they don't have symptoms, they're turning them away. So.
Great, thanks, Michelle.
Okay, I think at this moment, I'd like to thank everybody again for the discussion we had and all the input, comments, and I think we will jump over to the next session, and I will hand it over to Jose.
Great, thank you, Michael, and thank you everyone for participating. Really great and sharing the resources. This is the time again for the whole health system to unify and to really learn from each other during this moment, and also figure out what are our needs as well too. So in this next section, we want to see what resources are out there and what you need. In this call we have organizations that provide technical assistance, we have health plans, we have funders. So for this first question, I want to start by what external help will you ask for? Something that you can do yourself, or you don't have the resources. So please, I would like to invite all of you to chat in the here in the chat, and then also please feel free to mute yourself and ask for your need.
Can you hear me? This is Gloria Shire with Elite Care Health.
Yes.
Okay. So one of the things that we have seen is we're being bombarded from all the health plans, and everyone has their own information, but generally it's all the same message. So I've been trying to deliberately communicate with the providers on a limited basis so that they only get the most important details and data that they need. It would be nice if the plans would organize under ICE and continue their communications, in a uniform way, so that we don't bombard physicians. I've been asking some of the plans, should we fax blast or, communicate with the individual provider offices, but we want to do it in such a way that they're not going to view it as an additional burden, because they're already having to deal with their patients and they're getting information. If they're an IPA physician that has multiple affiliations, realize they're getting it from everybody else. And so I'm trying to be very conscientious of that so that we don't overburden them. So I think a united, collaborative ICE message would probably be the most useful way to communicate things.
Thank you, Cora. I see also a message here from the chat. It says from Michelle Duran. It says access to PPE. And we also have a message from Claudia Williams that says contact IPA is interested in getting a list of their BSC or Anthem or IEHP members who are at a higher risk so they can do outreach. Also, Claudia Williams said availability of test results from state or state, so it makes other intermediaries can share this info with the plans and IPA.
This is Crystal. I want to take a moment to your comment about the reducing the burden on providers right now, and I think trying to get them access to PPE, of course, very important, and we can do that. But also thinking about what can we do to reduce their burden from normal operations or consolidate messaging. So I will definitely share that idea with the plans around organizing their communications. And are there other ways in which we can kind of consolidate, unify, that would reduce burden on the front lines right now? That's a great theme.
I'm curious whether anyone on the call is kind of to Crystal's point of reducing burden on the front lines. The federal government is really lifting a lot of restrictions around telehealth. And I'm wondering whether anyone is doing work to kind of translate that into what does that mean for providing telehealth care. In the president's address the other day, he said, whatever, use FaceTime, anything to offer your telehealth services. So I think there's probably devil in some details there, and just curious as to whether anyone is like digging into that in order to translate what that means for, say, the, primary care physician who has a demand perhaps for telehealth, but no tools to do so.
I see a message from Whitney. It says, April, a summary of how a small practice could conduct telehealth visits, access to required tools, and coding to get paid will be very beneficial for sharing with practices.
Okay, thanks, Whitney. Yeah, so maybe it sounds like that could be a gap that needs to get filled fairly quickly, because I know the payment is changing too.
Yeah, I want to add, I saw a resource coming from an organization, let me see, eHealth Initiative. So I think their website is ehidc.org, but they have several webinars about how to use technology. And one of them, I think on April 7th, is around new strategies for using telehealth amongst primary care physicians. So we'll include that link on there.
Another research on telehealth, I don't know what she's doing, but Timmy Leslie from Blue Path has a telehealth coalition in California. So somebody might from CQC might want to contact her and find out what resources they're developing or could develop. Thanks, Claudia. Yeah, we will. That's great.
We have. Oh, yeah, go ahead, Chris. Yes.
I was just going to say, it looks like Amy Nguyen posted a really good document, Guide to Telemedicine for Physicians.
Yes, thank you, Chris. I was just checking right here in the chat. We have actually from Amy, just like you mentioned, and then Christina as well too. She posted a link here from Center for Connected Health Policy. I see also an idea from Stephen Hoy. The Zoom platform you all are using has a free 45-minute subscription that you can record it. And from Amy, we also have a guide to telemedicine for physicians here, a link as well too. Thank you everyone for your resources. This is great. Something else, for CQC members, a bunch of them are health plans, right? And they're through the state. And, we really want to share also what you need. So anything else that you have as well too, please chat in the chat box, and then we can definitely be a source of communication with them, a bridge of communication with them of your needs.
Yeah, I just want to repeat. This is April, the one that we heard from. I think it was Gloria. Sorry if I got your name wrong. Just the kind of streamlining of communications into one, so some level of coordination. So thank you so much for that suggestion. Any others?
Yeah, this is Stephen from PFCC Partners, and I think that is probably a good opportunity to take what I discussed earlier. If you're going to be centralizing communication to physicians, maybe using part of that time to centralize communication to patients and families.
Yeah, thanks, Stephen. That's great.
And I see a question from Michelle. So what are the health plans communicating to members? And I know we have a few health plans on the call. Would one of you be willing to share? And would it be helpful, I'm thinking for us at CQC, of kind of aggregating what the health plans are doing in regards to the members? Because I know many of you are contracted with multiple health plans and then trying to juggle all of that. So something that lets you know what they're doing while we did attempt to kind of streamline and consolidate.
Great. Okay. Thank you everyone for your participation. And at this moment, I would like to, as we're getting close to the end of our webinar, I'd like to hand the controls to April.
Okay, great. Thanks, Jose. So just to close us out, a couple of things. I've heard a number of offers for resources and support so far on the call. So Stephen from PFCC Partners, reviewing patient communications. If needed, thank you so much, Stephen, for that. Claudia from Manifest MedX. If you're interested in getting data, ADT and other types of data, please connect with her. And so I just wanted to pause and hold a little bit of space to see if there's any other offers for anyone else on the call in response to what you've heard or otherwise, or just what folks are experiencing. So please take a moment and put that in the chat or unmute yourself. I'll just stop talking here for a few seconds in case people wanna say that. Okay, looks like Stephen actually got a message from Blue Shield. I'm assuming that means kind of as a member.
Right.
So Stephen,
Sorry,
if you don't mind, yeah, great. That's okay. That's okay.
I was on mute when you asked for the health systems to speak up, or the payer plans to speak up, and yeah, the one I got from the health plan was as a member, and having those access, that succinct description of access, and discussion about costs for testing and treatment, all super helpful. They have a link to their teledoc on there, and it's all framed around what to do if you're experiencing flu-like symptoms instead of going to the emergency room. And I think something like that could be super helpful at keeping our health systems, under that utilization line.
Yeah, thank you so much, Stephen. That's terrific and great to hear that you got such helpful information. That's the type of communication that my offer out to you guys is for, to help build those types of communication with patients and families or your communities. That's support our large network of patients and families is happy and on standby to support. Thank you. Really appreciate that. That's great. So we just have like 2 minutes left. So we're not going to go over time. What we, the CQC team, would like to know, we can be a convener, right? We have connections to so many different stakeholders and groups across California in our healthcare system. So what we would love to hear from you, we're going to just launch a quick yes or no poll, because we want to know whether this was helpful and something that you feel like is useful to continue. So we would just like to hear a quick yes or no, Michelle, if you don't mind launching that poll. And you can answer it as you exit the call, but I want to just say, the question is really, would it be valuable to hold this space for peer sharing? So please answer the poll and let us know what you think. Thank you everyone for taking the time today to share your experiences. We just hope everyone stays well and stays connected to each other virtually and as much as possible in sharing resources. So thank you again to everyone. Feel free to drop off once you've answered the poll. We'll probably stick around just as a team. And if you have any questions for any of us, feel free to unmute and ask us as you leave. But thank you so much to everybody. Really appreciate your time today.
Folks, this is Gloria Shire again with Elite Care Health. I think one of the things, hi there. I think one of the things we do want to keep on the radar is the telemedicine. I know that Seema Verma this morning was talking about removing the HIPAA compliance. So I want to see what everyone is doing, because I think it is going to impact the future delivery of healthcare. And so I think this is something that this group would probably be very effective in managing and communicating what's happening with that.
Thank you so much for that, Gloria. Yeah, I think this is something that could turn out to be a real, you know, the crisis producing a huge opportunity actually for the expansion of telehealth. And I think trying to understand what some of these lifting of HIPAA rules, what that means for frontline providers is a real need. So thank you so much for that comment. I appreciate it.
And it may be something that we change some of the regulation on, because I think even with the millennials, that's something that they will definitely welcome. I know our senior members are more hesitant, but I think the millennials will change the way healthcare delivery is done because of telemedicine.
Yeah. Thank you so much.
Thank you all.
Yes, all the links will be compiled and shared with everyone on the call, just so you know. We'll share that back. Thanks. Have a great rest of your day, everybody.